Hello, my name is Michael Eisenberg. I'm the Director of Male Reproductive Medicine and Surgery at Stanford University, and I'm the corresponding author on the manuscript Testosterone Therapy and Cancer Risk. I want to thank the BJUI for their interest and for profiling our work. As the population ages, we are seeing more diagnoses of hypogonadism, and our treatment for these symptoms is excellent. However, there is concern about risk associated with testosterone therapy. Ever since Huggins and Hodges first noted a relationship between castration and prostate cancer regression over 7 years ago, there's been a concern that testosterone therapy may alter a man's prostate cancer risk. To date, there have been a number of retrospective and prospective studies examining this, and in general, they have not supported any risk of testosterone therapy. However, limited follow-up has been cited as a weakness of many of these studies. And indeed, you can hypothesize that with prolonged exposure to androgen, a man's prostate cancer risk may change. So to answer this question, we wanted to look at a retrospective cohort for men that have been on testosterone therapy a number of years. We also wanted to look at other cancers, as other cancers are known, some of them, to be hormonally dependent. So we retrospectively reviewed our cohort of men treated over the last several decades and stratified them into men that had and had not been on testosterone therapy. For outcome ascertainment for our cancer diagnoses, we linked our cohort of men to our state cancer registry, the Texas Cancer Registry. In total, we had 458 men who we examined, with an average age of about 55 and a mean follow-up of about 7 to 8 years. Our first analysis was to look at all cancers, and there was no difference in men that were and were not on testosterone therapy. When we looked at prostate cancer, again, there was no difference in prostate cancer risk for men that were and were not on testosterone therapy. And we looked at non-prostate cancers. Again, no difference in risk between men that were and were not on testosterone therapy. Interestingly, when we look a little closer at the prostate cancer group, there was a slightly higher risk of prostate cancer in our cohort compared to the general Texas population. And again, this is a very screened population, men that seek care, and that is consistent with prior literature that the screened population does have a higher risk of prostate cancer. When we further stratified our group based on PSA levels, not surprisingly, men with higher levels, above the median, which is about 1.1, did have a higher risk of prostate cancer compared to those that were below the median. Again, it's consistent with prior literature. So in summary, we conclude that there is no change in a man's cancer risk or prostate cancer risk with testosterone therapy. Again, I want to thank the BJUI and the readers for their interest in our work. Thank you.